being that it's spring in it's now spring in Chicago, and I have a lot of people that are working in their gardens or clearing up the basement or working on home improvement projects. Unfortunately, I also have a lot of people coming in with elbow pain. The typical problem with elbows will be to the lateral epicondyle, also known as tennis elbow. There is an opposite end, medial epicondyle, known as golfer's elbow, but this is more of a predominant problem. We'll talk about this first. I have an illustration on this shoulder elbow diagram of an elbow, and if you can see it, I'm not sure if you'll be able to see this online, but there's a group of red muscle that inserts into one point on the bone. To show you where that is on my forearm, the extensor complex of the forearm, which is responsible for pulling the wrist up and the fingers back, this extensor complex, which when it contracts and shortens, it does that action I mentioned. It is all able to do that action because it inserts with one area into this point here. And this is notoriously the most painful point in the evaluation when I go through and try to diagnose a patient with elbow pain. And it is notoriously positive, probably because of what we do in society. It's known as tennis elbow because we used to see it back in the 80s or earlier, most predominant with tennis players, mostly because back then we used wood, and with wood, especially right before hitting the backhand, there'll be a snap to the hip. Sometimes now we'll have English with some of the different fibers of the heads of the rackets, but back then it took a lot of impact, especially with wood, and it would translate it all the way up into the forearm. But that kind of impact day in, day out will cause this tendon, muscle tendon bone complex to get irritated. Now you don't have to be a tennis player to have it. It can be with painting where you're lifting up. It can be with using drills and power tools where you're triggering. It can also be with gardening and when you are hoeing or digging out. It doesn't matter what you do, but overuse of this in one weekend can cause irritation. That on top of a couple more weekends of work and or going back to your job and working with a computer in bad ergonomics or a bad desk chair setup can make it, although it's not the offending activity, can make that weekend injury persist on. So what I usually do would be first to come up with a diagnosis. And diagnosis for me is mostly with history taking and physical exam. I do not need an x-ray if the history is right on and there's no other forms of trauma. The one exclusion from that would be if I have anybody that's young, say greater than 12 years of age with growth plates, or older than mid-60s where I might be worrying about tumor formation or osteoporosis. In those cases, I have to make sure that bone is okay. But in your average standard Joe or Jane, I would usually start the treatment plan. Treatment plan first is to do no further harm. So we try to immobilize the wrist from doing this a lot. And that would usually be with a cock-up wrist splint. That's with a hard Velcro. It's got the Velcro braces that fit over the hard insert that sits on the base of the forearm. I have a watch on right now, but typically this just keeps you from moving up and down when it's applied properly. That will stop repetitive motion in helping with the healing process. Sometimes we'll do forearm braces. This is a basic forearm brace. It goes around, you wrap it around, and there's one point that is exerted right to the muscle. If you put the pressure in the muscle, it takes the pressure or it takes some of the work off of the insertion point that's already irritated, that tendon bone complex. And it's an old way to do it. It's kind of like acupressure or acupuncture, where you apply enough pressure and it helps to resolve or speed this healing up. It's symptomatically helpful. Unfortunately, what we found is that people will use these things, and this is one that has a small cushion in the part that's supposed to be over the area of irritation, or at least the muscle. There are nicer ones by Aircast that actually have a pillow you can puff up. But again, as I said, I used to have patients that would get relief temporary from using this and get back to the offending activity, and that's not good. So I usually will go with a wrist brace immobilization. Once you immobilize from further damage, then it's necessary to really educate the patient on how long this will take. If you injured this muscle, tendon, bone complex to the point where it's inflamed and full of blood, or at least there's in the strands of muscle, tendon, bone, there's small deposition of blood, you're going to have to take a little bit of time before that goes away. Just like a black and blue mark takes about 14 days to go away, hey, so will this at the least. So people who say that after applying ice or taking a pill they want to see it go away in 7 days, that's not reasonable. Usually the injury takes a second to come up, if it takes probably 2 to 4 weeks to go away. So during that 2 to 4 weeks, you have to be careful about the usual routine of work. If you're doing work with regards to keyboarding, or you're actually in labor and you have to paint, you have to pull things, this is going to get flared up at work, so you have to be careful. I'd hate to give work restrictions for an injury that occurred at the home, but sometimes that's necessary. So first, do no further harm. Then you start to help with the repair process or speeding up healing. Nutrition is always important. I always say if you can stay away from dairy, wheat, and gluten during the time period that you're healing up, great. If you can't, try your best. And sometimes supplementation of a standard American diet would be important. Omega-3 fish oil, multivitamin, vitamin D, all of them very important. You can see, I'll put links to my previous lectures as far as those 3 supplements for anybody, injury or no injury. But then turmeric, I think, is a great anti-inflammatory that helps. In addition, topical oils like helichrysum, I think, are great. If you can get to a physical therapist, sometimes the topical application of an anti-inflammatory or ultrasound to the area by physical therapy, if you have physical therapy covered in your insurance, I think it's a great thing. If you don't, sometimes electricity applied by acupuncturist or physical therapist, I think, is very helpful. These get connected to electrodes, and you put the electrode above and below the injury, and you give a small low charge, and it works just like applying acupuncture, but just to the skin. Again, the objective is to facilitate blood flow and help with healing. So electricity, ultrasound, topical anti-inflammatories. I love the use of Pensaid. That's a topical Voltaren. It works nicely in decreasing inflammation by getting to the source of the inflammation without necessarily being absorbed like taking pills. If you can't take pills, it might be a nice option. If you don't have any problems with reflux or the need for Pepcid, Prevacid, Zantac, Tagamet, Prilosec, then sometimes just taking an oral anti-inflammatory on a regular basis, not the highest dose, but on a small, regular, regimented basis, will help slowly chip away the inflammation from the inside. Again, I like relying on turmeric, and sometimes if the joint is involved, the bone-on-bone joint, glucosamine sulfate is very important. And if you can't, again, maximizing on nutrition, getting an anti-inflammatory, maybe even a prescription anti-inflammatory from your doctor is important. So we speed up and compress the time frame of healing by first doing no further damage, next by improving nutrition and healing time. Then sometimes we have to inject steroids into the area because it's just too painful. Usually what happens with steroids, if we can get right to the source of the inflammation, it hurts going in, but it's great when you leave the office. Usually you're pain-free at that point in time, but don't be fooled. You're pain-free with a numbing medicine, and you're pain-free with a little bit of steroid mixed in. So that's supposed to heal up, speed up your healing process. That does not mean you return back into gardening or home improvement. You still have to take the healing process into account, which again usually takes about 2 weeks. So persistent use of the splint in addition to that shot might be necessary. All else fails and it's not presenting as usual, that's when we go for an MRI and see if there's any chronic tissue damage called tendinosis, or actually fraying apart and tearing of muscle tissue. If that's the case, and you have chronic scar damage, you might have to have it opened up, and the surgeon might have to help clean up some of the scar tissue so it can heal up better and get some blood flow through it. That is the typical scenario that I go through with regards to lateral epicondylitis. As most of you know, my patients, I like to stay in the tract of alternative and complementary medicine and try to avoid prescriptions when possible. But in this case, where there's a lot of suffering and possibly disability where you can't work, a steroid shot might be necessary, and of all the steroid shots I put into the bone, or actually into the body, this is one of the fastest to heal up. This and then plantar fasciitis, excellent turnaround time, takes away a lot of suffering, and also, again, it compresses the time frame of healing, which is ultimately what we have to do.